So, Tom, how did you find out that you had AML?
About the middle of December 2017, I developed a nosebleed that would not completely stop. It would start, slow down, stop for a few minutes, and then start again. Not pouring out, just kind of dripping along. This went on for like 5 or 6 hours. My wife was getting more and more nervous. She's a retired RN. So she decided we better go to the ER at Beth Israel Deaconess in Plymouth, Mass, which we did. They ran a CBC, complete blood count, and found that all of my counts were extremely low. They didn't treat me at that point. They set me up with a oncologist, Dr. Kumi, at the hospital, which I met a couple of days later, and he set me up. He assumed MDS, but he set me up for a bone marrow biopsy, which I had, I think it was a week later, and that showed about 12% blast level, which was considered MDS at the time. At that point, I asked for a second opinion. Dr. Kumi contacted Dr. Steensma's office and had me come into Dana-Farber to meet with Dr. Steensma. He determined that Dacogen was an IV treatment that could work. I had that for 7 months. It's something we take. You're infused for 5 days, 21 days off, infused for another 5. And that went on for 7 months. It didn't have any influence at all. No help at all to the MDS, or actually to the blood counts. And met again with Dr. Steensma, and shortly before I met with him, it turned out that a drug called venetoclax had become approved by the FDA, and Dr. Steensma recommended that I go on that to see if it would be of help. And I can give you some dates, but I believe that I started on that sometime in September of 2018. And I was on it for probably 4 months until January of 2019, when I had another bone marrow biopsy, and that showed that I was in remission. There was no more AML, which of course we were very happy about. So between the venetoclax and the combination with Dacogen worked very, very well. And as I mentioned earlier, that worked for 8 months.